During a pregnancy, screening for Down syndrome is one of the most important things that I, as a maternal-fetal medicine specialist, deal with on a day-to-day basis. Now, screening for Down syndrome is something that your provider should talk to you about always. Everyone should be offered Down syndrome screening. There are also tests that you can do to try to diagnose Down syndrome, as opposed to just a screening test. There are a lot of different options, and they can be very confusing across the board. What we'd like to work on today is figuring out a little bit of the definitions surrounding Down syndrome, the tests that are available, and how to best advocate for yourself to ask the right questions. So today, we're going to talk about Down syndrome screening. Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down into simple terms the best I can to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal-fetal medicine specialist, and today we're talking about Down syndrome screening. Before we get started today, as always, I just want to remind everyone you can find a screening tool, an advocacy sheet on the website, and you can go straight to drlexihill.com/advocate. Download this sheet. It has the 13 most common questions that you should be asking your provider at your OB visits. For people who come to me and we're talking about counseling for Down syndrome, I oftentimes hear, I don't have a family history of Down syndrome, and for that reason, I don't want screening. I make sure to explain to them, even if you don't have a family history of Down syndrome, it doesn't mean that you don't have a risk still of having a fetus that has Down syndrome. So we base your risk of Down syndrome on your age, and that's a table that anybody can look up. And as we age, our eggs are older and there aren't as many of them. So the risk of Down syndrome increases because of those things. So I let people know that even if you don't have Down syndrome in the family, there's still a risk that's there, and we can give you that exact number that's a quoted risk. So be aware that most Down syndrome, upwards of 95%, more than that, is not coming from someone who has it in their family. It is random, sporadic, meaning most of the time, over 95% of the time, individuals who have a child with Down syndrome, they did not have that running in their family. So just be aware of that. And if that does change your decision for how you want to opt for screening or diagnostic testing for Down syndrome in a pregnancy. So first off, let's talk about expanding your knowledge. And I like to typically start with some definitions. So since we're talking about Down syndrome screening, let's talk about what Down syndrome is. So Down syndrome is also called trisomy 21. So if you think of the word trisomy, we're talking about 3. So typically we should have 2 chromosomes of chromosome 21. Any chromosome in the body, we're meant to have 2 of those chromosomes for the numbered chromosomes. So what trisomy 21 means is that instead of 2 chromosomes, there actually are 3 chromosomes. So that's where the term trisomy 21 comes from. And trisomy is a type of aneuploidy. So sometimes people will hear the word aneuploidy screening, and sometimes that's used interchangeably with Down syndrome screening. Aneuploidy simply means that there's an abnormal amount of chromosomes. And then trisomy specifically means that there would be 3 for the chromosome that you're talking about. There are great references that I'll list below that have kind of a glossary and an area of definitions for genetic terms surrounding a pregnancy, specifically with regard to Down syndrome. Now that we know that Down syndrome is trisomy 21, one of the other parts of the definition is that if someone has Down syndrome, what does that mean for them? So they oftentimes can have certain what we call phenotypic features, meaning they could look a certain way that matches with Down syndrome. Some of these things can be the nose bridge right here, that bone can be flattened or absent. There also can be some changes to the facial features, shorter stature, arms and legs being shorter, and then finally some intellectual delays. So those are some things that can go along with Down syndrome. So now that we know some basic definitions for Down syndrome, the next thing I want to focus on is kind of like the big thing that I want to tackle here. What are the options for screening for Down syndrome? When I think of screening for Down syndrome, I think of 2 categories. One of those would be serum screening, so we'll call that a blood test, okay? The other one is going to be with an ultrasound. Now, when I think about this all together, I do want people to know 2 different types of screening options we're going to tackle: serum screening or a blood test, and then an ultrasound, different types of ultrasound. Then we always have the opportunity for something called diagnostic testing. I'm going to talk about the screening testing first, or screening options. Then we'll talk about diagnostic testing. So let's break down the screening options that someone has for Down syndrome first. So screening options with the blood test, we are going to group those into 3 different options that you have. Okay, so we're going to tackle these, and if you want right now, you can go and check out a download that I have, and the link for it is below so that you can follow along with this flow sheet. Now, before we go into these 3, be aware that there are other types of screening that are called combined blood tests. We are not going to discuss those today, but that is a question when you talk to your provider, when you're asking them, what type of blood test am I having performed? So let's look at these 3 different basic options for a blood test that's screening for Down syndrome. The first listed is something that we call first trimester screening. The pro of this, it can be done in the first trimester. The con of this is that it has to be done at a specific gestational age. So this test has to be done somewhere between 10 and 14 weeks of the pregnancy. That's an important thing, so you have a limitation there. The other thing I want to point out for each of these serum tests or these blood tests, what is the detection rate of Down syndrome? So the detection rate of Down syndrome for first trimester screening is approximately 85%. Now let's go down to the second option. The second option that I list on the flow sheet, if you have that downloaded and can see it, is bolded. This one is called cell-free DNA screening, okay? Sometimes people call it non-invasive prenatal testing. Sometimes people call it non-invasive prenatal screening. Because of those initials that are there, oftentimes you'll hear individuals say NIPS, N-I-P-S, or NIPT for the non-invasive prenatal screening or non-invasive prenatal testing. This also is a blood draw. It's bolded because when we're looking at pros and cons, this one has a Down syndrome detection rate of 99%. That's way better than the one I just mentioned, which was 85%. Okay, this is the one that is considered the best at screening for Down syndrome. So the pro of it, really good detection rate. Another pro, you can do it as early as 10 weeks in the pregnancy and then any time as the pregnancy progresses. You're not limited to just the first or the second trimester. So what are some cons of this? This test can take up to 2 weeks to get results. It cannot be done if you've had a vanishing twin diagnosed in this pregnancy. It can come back unable to be determined sometimes for various reasons. In those cases, talk to your provider. It also can come back positive for everything it screens for. And in those cases, it has been linked with detecting maternal cancers. So it is a little bit complex in the way in which it's done because it's based on something called cell-free DNA, okay? And that is a whole nother complex topic that we can get into some other time. So just be aware that if you're having cell-free DNA testing, aka non-invasive prenatal testing, aka non-invasive prenatal screening performed, talk to your provider before that test is sent. Any of these screening tests, you should talk to your provider before they're sent. The other thing that's very important with this cell-free DNA screening test is that it tests for other things too, like trisomy 13 and trisomy 18. And it can also look at the gender of the fetus. So you really need to ask your provider, hey, when we're sending this test, are we sending it just for Down syndrome? Or are we sending it for trisomy 13, trisomy 18, and also attempting to look at the gender? So a lot of a discussion needs to happen before that test is sent. The third and final one I'm going to mention for blood testing for screening for Down syndrome is something called a quadruple screen. We just call it a quad screen for short. It's called a quad screen because it sends 4 different maternal analytes. Those analytes are sent, come back, and they will return and say the Down syndrome risk is 1 in fill in the blank. Now, this test also, one of the analytes that's being sent is screening for something else, which is called an open neural tube defect, things like spina bifida. It also is trying to calculate any risk of trisomy 18. Again, these tests can be very complex. The Down syndrome detection rate for a quad screen, only about 81%. All right, we're doing just the basics here for serum screening or a blood test to screen for Down syndrome, generally 3 options. First trimester serum screen with the Down syndrome detection rate of about 85%. The cell-free DNA screening, also called non-invasive prenatal testing, Down syndrome detection rate of approximately 99%. Third one that sometimes is still around is the quad screen, which has about an 81% Down syndrome detection rate. All right, let's move over in our flow sheet and look at the ultrasound screening options that are available when screening for Down syndrome. Now, the first one that's listed that you have the option for is something called a nuchal translucency. This is a conversation with your provider if they're still offering nuchal translucency screening. A lot of places aren't doing them as much anymore because that one test I mentioned, cell-free DNA screening, has a really nice high Down syndrome detection rate. If someone chooses to just do ultrasounds and says, I don't want to do any blood testing or serum screening for the risks of Down syndrome, a nuchal translucency screen is an ultrasound that needs to be done at a certain time from 11 to 14 weeks of the pregnancy and has a Down syndrome detection rate of approximately 70%. Now, this is when it's done by itself. Again, complexities, you can do the Down syndrome screening with a nuchal translucency and also a blood test. So again, many ways to skin the cat. But when we're looking at just the ultrasound and just a nuchal translucency, that Down syndrome detection rate is about 70%. The other ultrasound that is the biggest, most important ultrasound in this pregnancy is that 20-week anatomy ultrasound. Now, does it have to be done at exactly 20 weeks? No, between 18 and 22 weeks is the goal there. This ultrasound is considered about 80% good for Down syndrome detection rate, okay? It is the big one we love to see. And what are they looking for specifically with regard to Down syndrome? They're looking for things that are called soft markers. And that is a whole nother video that we will go through in case you have had a soft marker on an ultrasound or want to learn more about those. That is how an ultrasound, when we're talking about how does it try to screen for Down syndrome, we are looking for soft markers. Soft markers, just as a small side note, are things that correlate with Down syndrome. And there's a range. They may correlate mildly, moderately, or severely, meaning when we see them, we're a little concerned, pretty concerned, or very concerned that the fetus may have Down syndrome because of how common that soft marker or ultrasound finding is for being associated with Down syndrome. All right, so we have talked about screening tests that are blood tests. We have talked about screening tests that are ultrasounds. Now we're going to talk about diagnostic tests. And really, there are 2 options that we have for someone during a pregnancy, and we break them up by gestational age. Before I discuss those 2 options, be aware that everyone during a pregnancy has the choice of doing invasive diagnostic testing. Okay? You don't have to have something that's wrong. You don't have to have anything abnormal on an ultrasound. You can just choose to have this done to know with more certainty because it's considered a diagnostic test as opposed to just having a screening test. So be aware that this is an option for everyone. Now, these 2 options we split up kind of by gestational age. The first option that we talk about is something called chorionic villus sampling. We call it CVS. This is the one that is an opportunity during an earlier time in the pregnancy. Earliest time is 11 weeks all the way through that 13th week. So it's at the very end portion of the first trimester. The other opportunity is something called an amniocentesis. The earliest we can do this is at 15 weeks in gestation and then anytime later in the pregnancy. Everybody kind of has their own opinion about these 2 different types of invasive testing. little bit of basic information. If you're in the right hands, the risk of miscarriage or loss of the pregnancy after either of these invasive procedures is approximately the same. Data is a little different. I would probably say 1 in 500 is a general number that's quoted. A chorionic villus sampling is trying to get portions of the placenta. The amniocentesis is getting amniotic fluid. So those are some of the differences between the two. Anytime you're considering diagnostic testing, ask your provider which one they do more frequently. Are they comfortable with both of them? And a lot of docs now don't do CVS procedures. If your doctor doesn't, you can always ask if someone in their practice does, or anyone that is close to your neighborhood in the city in which you live that would have that as an option for you. We're going to go on now to developing some skills. So now that we've learned the definition of Down syndrome and the options that you have for screening through a blood test and ultrasounds, as well as diagnostic options, then let's go into, well, what are the right questions that you can ask to help you really develop the skills of communication between you and your provider. Question number 1 would be at your first prenatal visit, can we discuss my options for Down syndrome screening? Opening up that conversation, if it isn't already open from the provider end, is super important. Remember that some of these tests need to be done in the first trimester. So depending on your options, the resources around, maybe even your insurance, you need to know what your options actually are and open up that conversation at the first prenatal visit so that you can plan accordingly. Question number 2, if you do opt to get blood testing for your screening, ask what type you're going to have done and how you will get your results. Also, when you will get your results. So you want to be able to follow up on those results and know when they're coming to you. Is someone going to call you? Will it show up in a portal? Are you going to get the results in an email? Ask about that, as in how you will get the results and when. Will it be 1 week? Will it be 2 weeks? And if it's after 2 weeks, what do I do? Do I call somebody? Those are some really good questions to ask. The other part of that is asking, which type of testing or screening that you are having performed and clarifying what it's being sent for. Is it just being sent for Down syndrome screening, which is trisomy 21? Or is it also going to be screening for trisomy 13 and 18? Is this the test that will help to identify the gender of the fetus? So those are a lot of questions involved in there, but make sure that before that blood test is drawn and sent, that you ask some of those questions. And finally, big advocacy question here. Since that 20-week anatomy ultrasound is recommended truly for everyone, ask these questions. When am I going to have it done and where is it going to be? So yes, we're talking about screening for Down syndrome, and this is a part of that. However, this is a part of everyone's pregnancy. A 20-week anatomy ultrasound, so important. So important. And again, it can be between 18 and 22 weeks is the ideal time. Ask when it's going to be scheduled for you. Try to get it in that time frame of 18 to 22 weeks. Ask where it's going to be done. Do you come to your OB office? Do you go to a maternal-fetal medicine specialist office? That's what I do, which is considered a high-risk pregnancy doctor. Do you go to a radiology center? Do you go to a hospital? You can even go one step further and say, who's reading my ultrasound? So the ultrasonographer doing your ultrasound should be well skilled in doing obstetrical fetal ultrasounds. However, that's not the person that reads the report, that looks at all the images and makes a final kind of report that they send normally to your OBGYN office. The other question is your OBGYN reading this 20-week anatomy ultrasound? Are they comfortable reading those scans? Do they know what they're looking for? When you get your anatomy scan at 20 weeks, roughly, you'll get one of two types. Sometimes they'll call it a basic versus a detailed. And that is a big question to ask. Hey, when I'm getting my 20-week anatomy ultrasound, am I getting the basic one or am I getting a detailed one? All right. Basic is for a low-risk pregnancy. Let's say you're 22 years old, it's your first pregnancy, you have no medical complications. We call that a basic anatomy ultrasound. Let's say on the opposite end, you are 47 years old, it's your fourth pregnancy, you have high blood pressure and diabetes, and this was an IVF pregnancy. That is a detailed anatomy ultrasound. And the reason I bring that up is because that may change what they tell you for where you are getting your ultrasound performed. Maybe the ones that are basic go to one place, and then those that are detailed, that need to have more images seen during that ultrasound, maybe those go somewhere else. Who knows? But ask your provider about that, okay? The final question that I will mention here, and this can be maybe after your ultrasound's done, or even after your blood test comes back, or before. It's a good question to ask, but the question is this: if I have abnormal results on my blood test or my ultrasound, what will happen next? It's just always good to ask. Who will you go see? You would definitely need to make sure that you have the opportunity to get genetic counseling performed, preferably with a geneticist or genetic counselor, and also that you have the opportunity to discuss the options for invasive diagnostic testing. Remember, that's the CVS, chorionic villus sampling, or an amniocentesis, depending on the gestational age. Finally, let's get to our impact. We have expanded our knowledge surrounding Down syndrome and the tests available. We have developed skills on the questions to ask to our provider and how to ask those questions. My goal for this impact today is that we have allowed you to increase your knowledge of your options for Down syndrome screening, also increase the ability for you to choose the options and know a little bit more about them, as well as your communication with your providers to help you choose the right track for you and what feels right for you in a pregnancy with regard to Down syndrome screening. Also, the impact of you understanding you have the opportunity for screening tests as well as diagnostic tests in every pregnancy with regard to Down syndrome. All right, some recap items here. Thing number one, everyone is offered screening for Down syndrome. Can be a blood test, can be certain ultrasounds. Everyone should be offered this opportunity. Thing number two, everyone should be having an ultrasound done at 20 weeks. This ultrasound is our big anatomy ultrasound to look for all the parts of babies head to toe and looking for anything that we call soft markers that could be indicative of increased concern for Down syndrome. And the third thing, if you have anything that comes back from a blood test or an ultrasound that shows an increased concern for Down syndrome, make sure to talk to your provider about next steps, talking to a genetic counselor, as well as your options for invasive diagnostic testing. All right, don't forget to download your flow sheet below so that you can print that off if you need. It has some of the questions that we talked about today that are so important to ask your provider. You also have the other download at drlexihill.com/advocate with those general 13 questions to ask your provider. So don't forget about that as well. I hope you were able to learn a lot today by watching this video. If you have any questions or comments, leave them in the box below. Enjoy your downloads. And as always, I'm Dr. Lexi, wishing you a happy and healthy pregnancy.